Hi guys, today we are talking about acute kidney injury, which is a sudden onset of renal damage, loss of renal function due to poor circulation or renal cell damage, and it's usually reversible. It may resolve on its own, but it can lead to permanent damage if it is not reversed quickly. All right, the causes. We have pre-renal causes, which could be decreased blood flow to the kidneys. This does account for the majority of cases. So we're going to see hypotension, hypovolemia, decreased cardiac output, like heart failure or shock. We have intrarenal causes, damage within the kidney itself, tubular necrosis, infection, obstruction, contrast dye, or nephrotoxic medications. And lastly, we have postrenal causes, damage between the kidney and the urethral meatus backs up, causing damage to the kidneys. This could be due to infection, calculi, or obstruction. We have different phases of acute kidney injury. Initially, we have the onset. We would note a decrease in the baseline urine output. We have the oliguric phase, decreased urine output less than 400 milliliters per day. This is the sickest phase where there's an elevated BUN and creatinine and a decreased glomerular filtration rate or GFR. We have the diuretic phase where they're beginning to recover. There is a gradual increase in urine output followed by diuresis. And lastly, the recovery phase. Now at this point, we have decreased edema. The electrolytes start to normalize and glomerular filtration rate starts to increase. All right, for assessment of an acute kidney injury patient, signs and symptoms result from the inability of the kidneys to regulate fluid and electrolytes. We'll see azotemia, which is a retention of nitrogen wastes in the blood. We're going to see elevated BUN and creatinine. Decreased glomerular filtration rate, or GFR. Decreased urine output in the oliguric phase, which should see an increase in diuretic phase. And then signs of volume overload, like hypertension, peripheral edema, pulmonary edema. Signs and symptoms of infection, if that was the source or the cause. Metabolic acidosis, the kidneys are not holding HCO3. And electrolyte abnormalities, elevated potassium, decreased sodium, elevated phosphate, and decreased calcium. All right, the therapeutic management. During the oliguric phase, we're going to restrict fluid intake because there is volume overload, give diuretics for volume overload, and identify and treat the cause. During the diuretic phase, we need to replace fluids and electrolytes, and especially watch potassium and sodium levels. If the patient is not recovering, dialysis may be needed. All right, again, guys, we were talking about acute kidney injury, which is a sudden onset of renal damage, loss of renal function due to poor circulation or renal cell damage, and it's usually reversible and usually may resolve on its own. It can lead to permanent damage if not reversed quickly. Thanks, guys. This has been another episode of NCLEX Flash Notes podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's NCLEXbook, NCLEXBOOK.com. Happy nursing!